Spinal cord injuries, functional significance of cervical, thoracic, and lumbar lesion levels. C1 to C3 cervical lesions. Respirator dependent, totally dependent. C4 cervical lesions. Incapable of voluntary function in arms, trunk, or legs. Poor respiratory reserve, totally dependent. C5 cervical lesions. Can stabilize and rotate neck. Has function of rhomboids and deltoids, allowing some shoulder movement, elbow flexion, biceps, and brachioradialis partially innervated. C6 cervical lesions. Can move shoulders well, strong elbow flexion, wrist muscles allow weak closure of hands, can use large handles, lightweight objects, can sit up in bed and help and roll over. Still needs attendant, can drive van with hand controls. C7 cervical lesions. Can lift own body weight, can use hands, which are weak and lack dexterity, can eat independently with some assistance, can find a wheelchair, can live independently and manage self-care in wheelchair accessible environment without attendant. Thoracic lesions. T1 thoracic lesion. Independent in bed, self-care, short or lifting weights. Lacks trunk stability, respiratory reserve, and trunk fixation of arm prime movers. T6 thoracic lesions. Capable of heavy lifting because of thoracic musculature. Increased respiratory reserve, independent transfers, self-application of braces. T12 thoracic lesions. Can ambulate with crutches and braces, but still uses wheelchair as primary means of mobility. Lumbar lesions. L4 lumbar lesions. Complete independence in all phases of self-care and ambulation, usually aided by crutches or canes.